Hey guys, welcome back. I got Beatrice here, and we're here to talk to you about some of the most common ball python ailments you're going to come across, how to spot them, treat them, and avoid them. For these animals to show any kind of weakness or symptoms, it has to be really bad. Because in the wild, if they show that, they become prey. If you notice any of these symptoms in your snake, the number one thing you need to do is take them to a vet and make sure and confirm what they have, no matter what your suspicions may be. And then overall, the quicker you get them to a vet and get that diagnosed and get the proper medication or antibiotics for it, the better chance your snake has of surviving. Hey guys, real quick break. Please don't forget to like, subscribe, hit that notification button down below, and share this video with your friends. Now back at it. So the first one we're going to talk about is parasites. Internal and external. So internal, you're going to be talking about like protozoa, worm-like parasites. And for this, you're going to be prescribed a dewormer. Consult with your vet first, but one thing that has proved to work at times is this stuff right here. And this is, it's a word I can't pronounce. It's metronidazole or something like that. But anyways, Metroplex, I got it off Amazon. It treats protozoan parasites. External parasites like snake mites can be very problematic, especially if you have a large collection. One, because they're gonna infest your entire collection and it becomes very difficult to get rid of them. You're talking emptying out all cages of substrate, cleaning down your cage and animal regularly for at least 2 weeks to make sure you've gotten all the mites and their egg, keeping them on paper towels as well, which also proves to be a difficult task in keeping them hydrated. So these mites are not always visible. You're going to want to look around the eyes, in your snake's heat pits, and then in between their belly scoots or scales underneath. Typical ways to avoid bringing home parasites. Be very careful when you're handling other reptiles, especially at a pet store or a reptile expo, because you never know whether that snake you're holding is sick or not. Like I said, a lot of times these guys will not show any symptoms. So some ways to avoid this would be to clean after going to a reptile expo. Make sure you're cleaning really well after holding other people's reptiles, and being careful of who you let hold your animal. Somebody who has an infected animal may pick yours up and spread the parasites to your animal. And when I say be careful when you go to an expo or hold other people's animals at a pet store or at a friend's, you want to go the whole 9 yards. I mean, I usually don't come back into my snake room until after I've changed my clothes and showered. Another common ailment you're going to face with your ball python potentially is stuck urate. And this is a buildup of hardened, dried urate, usually right around the cloaca here, which is right by their tail. And it's something that becomes too stiff and difficult for them to pass. Some symptoms of this may be some gas distension, so a bloated belly. You typically can run your hands down their belly, squeezing softly, and feel something there when this is the case. Causes of this, it's typically dehydration. So usually you check dehydration if you pinch their scales here, and how quickly it returns back to its normal shape. Usually, if it takes a long time, they're dehydrated. If it bounces back quickly, it shows that that's a well-hydrated animal. Why they may become dehydrated is stress, illness, or if they've been on antibiotics. So stress being that if you've got your animal in an enclosure where they don't have enough cover or foliage for them to travel from their hide to their water dish, they're going to choose safety over going and getting that fresh water and hydrating themselves. So it may be something where you need to add some foliage to your setup or more hides to your setup so they can, in cover, get to that water dish. Some ways to avoid this is make sure you have enough foliage, as I just said, and make sure you're providing clean water on a regular basis. I'd say no more than every 2 to 3 days, or as often as possible. And then also make sure you're washing that water dish when you are performing that water change. And one good way of telling is if you put fresh water in your snake's enclosure and they immediately come out and start drinking, that means they were waiting on that water. That means the water that was there previously was, in their mind, not good, so they were not going to drink it. So that usually is what tells me, okay, I need to do this a little bit more frequently. Number 3 is respiratory infection. And this one is typically you'll hear wheezing, you'll see a mucus discharge or bubbling around the snake's mouth, and you'll see a nasal discharge of mucus as well. And you may hear them make a noise that sounds somewhat like a cough or a sneeze and going off food. So typically this one is pretty serious. They will typically need antibiotics. The question will just be which antibiotics they need. So you're gonna need to get that animal to a vet. They'll typically perform a swab of their mucous membrane and send that out for a culture to find out which bacteria they have present in their respiratory system, and then also what antibiotic is going to work for that. The earlier you get to the vet, the better on this one, because the more that bacteria takes hold in their respiratory system, the harder it is to get rid of and cure. And this can be something as quick as 2 weeks, or you could end up treating your animal for well over a month. It just depends on how seeded this bacterial infection is and how well they respond to the antibiotics and how strong their immune system is as well. For this, you will probably be prescribed antibiotics, either oral or injection. For oral, something that works well is putting a credit card or a tongue depressor up against your snake's mouth, kind of opening up, and then taking that plunger, syringe type thing that you would give a baby medicine with, and you're going to push that down the throat of the snake. For the syringe, you're going to give a shot in between the scales, usually up on this muscle here between the spine and the ribs. And that's a good place to put that. And then I always like to give these animals frequent soaks. Use reptile soak. I think it's made by ZooMed, and it's just probiotics, prebiotics, and other minerals and good things this snake needs. And it also keeps them hydrated, because these antibiotics, some of them can take a toll on the animal's hydration, along with them just not feeling good, so they don't want to leave their hide and go get water. Some of the causes of respiratory infection are typically too high or too low humidity, or just general unclean conditions. So what you're going to want to do is make sure you're spot cleaning daily. If you see urate or feces in your snake's cage, you're going to want to make sure you get rid of that as soon as possible. And then I use a water hexachloroquine, make sure after I remove that waste, I make sure to get all the reptichip or substrate around it. You don't want to skimp on that, and just in case it's been saturated with the animal's waste. That hexachloroquine, remember, and even F10, if that's what you're going to use, they need to sit on that surface for 10 minutes to be effective. It's not just a spray and wipe and you're done. Now for deep cleaning, you're going to want to do that on a regular basis. I typically deep clean and change out these tubs somewhere between every 4 to 6 weeks. My animals will also tell me on this one when it's time. Typically I'll have a very good animal that's eating all the time. All of a sudden they refuse a meal, refuse 2 meals maybe, and I know, okay, it's time to clean these cages, or something's up. Maybe I missed something. Maybe I didn't wipe something down good enough. And typically for me with these tubs, I'll take that, I'll do a Dawn dish soap with warm water, clean the whole thing down. Then I spray it down with my sanitizer, either F10 or hexachloroquine. And from there, fresh substrate for the animal, fresh water dish. Make sure they are in a very clean environment. Another common ailment is going to be skin infections, which is going to refer to like a dermatitis or a scale rot. So some symptoms of this could be too dry, which will result in a stuck shed and the skin around that stuck shed potentially becoming infected. For it being too wet, what you're going to notice is typically on the belly is where you'll see it is a red or pink coloration to the scales, and maybe even be bad enough to where you see a blister type sores, and these sores can become infected. For this, you're going to want to keep the animal as clean as possible in those areas, make sure they stay hydrated, and I would get them to a vet as soon as possible. They may have you keep those areas clean with some kind of ointment, maybe a triple antibiotic ointment onto that to keep it clean. You're going to want to remove substrate from your animal's enclosure and probably keep them on paper towels for a short amount of time to make sure those sores are staying clean. And again, a way to control this is the same way we've talked about previously, is humidity. You don't want to leave your substrate sopping wet to where that animal's just lying in a sopping wet substrate. That's going to give that too moist conditions for that scale rot on the belly, and then also enough humidity that they're not going to get too dry and have stuck shed. The last two I want to talk about are very serious. There is no treatment for these. These typically end up resulting in the snake ultimately being euthanized at some point, and that is IBD and nidovirus. So IBD is something where you may see your snake stargazing, so that's like almost looking up and backwards and looking almost like they have a wobble, as if like the spider gene. The other symptoms are is if you set your snake upside down, they cannot correct themselves. If I set Beatrice upside down, you'll see her start kind of flipping her head over on that side right away. An animal with IBD will not be able to correct itself. It'll show that wobbly type behavior and it'll remain on its back. This is very, very contagious. This disease is sometimes common in boas. So if you do keep boas and pythons, be very careful to wash your hands and sanitize your hands between handling. For nidovirus, this is going to be a lot of the same symptoms as a respiratory disease, and sometimes they can live perfectly healthy with nido without showing symptoms. For this one, RAL, you can buy swabs and kits on there in packs of 25, 10, 100, I forget how many different kits they have. What you do is they'll send you the swab and the kit. You print out the paperwork to fill out. You will take the swab from your animal's, usually their mouth, depending on what you're testing for, but for nido, it's going to be the mouth. You put that back into the tube that they provide with the swab. You fill out the paperwork. You send in a check or prepay online what you want, and they get back to you within 24 to 48 hours. And I believe with the nidovirus, you have to overnight. That sample's not going to be usable. Make sure you're keeping your husbandry in where it needs to be. You're following proper quarantine standards. If you bring a new animal into your collection, you're going to want to quarantine that animal for at least 4 to 6 weeks, I'd say, in a separate room if possible. And keep that animal on paper towels so you can look for any potential symptoms of these diseases. If you want some more videos like this one, leave us a comment down below. Please don't forget to like, subscribe, hit that notification bell, share this video with anybody you think might need it, and don't forget to check out these videos here.
Yeah, let's see how you do under pressure. I've been wanting this shit forever. I've been in the field with whatever they throw at me. Brush it off, pick myself up, moving on to the better. Okay. Hey.